Assalamu alaikum. My name is Nazifa Khanom and my ID is 221660009. The paper which I'll be presenting is Simulation and Modeling Efforts to Support Decision Making in Healthcare Supply Chain Management. Advances in healthcare management systems help improve the organization's operations and management. Several models for SC and SC management have been introduced in the healthcare business, yet the challenges involve slow down progress and hinder further benefit. Simulation modeling is used in various fields to allow developers and users to represent a system and examine its operations using different possible scenarios and conditions. The objective of this paper is to present and analyze past simulation and modeling efforts to support decision making in healthcare SCM, to identify the key challenges associated with SM in healthcare SCM, and to discuss new technologies emerged to meet these challenges. Competition with the healthcare industry is on the rise, and to stay in the market, healthcare organizations face the challenge to reduce operational costs while maintaining, if not improving, the quality of patient care and services provided. Supply chain management becomes a high management concern as it costs as much as 40% of a typical hospital's operating budget, the second largest expense for hospitals after labor. By nature, SCM is a complex, dynamic, and distributed environment. It is also governed by uncertainty and high variability. This is so because it encompasses integrated and interrelated activities undertaken by different and distributed parties. Efficient management of SC entails making informed decisions based on a holistic view of all animals that affect SCM process. To get there, SC managers in healthcare organizations need to have better visibility into their SCM processes to understand the cause of uncertainty and the impact on these processes. Many researchers argued that SM is a very powerful tool for gaining insight into SCM. In view of these studies, the benefits of SM in SCM include understanding overall SCM processes and characteristics, capturing SCM dynamics, modeling unexpected events, and understanding their impact on SC, and minimizing the risks of changes in the planning of SCM process. Accordingly, it is important to have a good understanding of the benefits of SM in SCM optimization and what the current issues and challenges in the field. The application of SM in healthcare SCM is limited in comparison to other sectors, yet it is steadily on the rise. Several studies explored the value of SM to support decision making in healthcare SCM as in other industries. Most studies develop SM tools to tackle problems in healthcare SCM. For the methodology part, I will discuss about the healthcare SC design and management. The complexity of the SCM problem magnifies with its focus on the healthcare industry. Healthcare SCM is designed to assure a high service level by maximizing the allocation of resources to respond effectively and promptly to the patient care needs. Besides that, it immediately impacts patients' lives rather than their livelihood. Therefore, healthcare SCM is different from SCM in other industries as it handles a diversity of items in widely various varying quantities in response to the large number of diagnosis types and procedures. Unlike other industries, products cannot be promoted or auctioned when the expiry date approaches and eventually they are destroyed. In healthcare, ACM enables patient care through supplying the diverse medical professionals with products and services they need to deliver prompt and best quality medical care. At the same time, SCM is set to enable the strategy of the healthcare organizations maximize patient care and minimize costs. This can be achieved by ensuring product availability, minimizing storage space, reducing material handling time and costs, and minimizing non-liquid assets. Thereby, decision-making processes in healthcare SCM must consider many elements such as cost, profitability, standardization, and inventory management. The modern SCM process in healthcare is divided into a series of cycles, each performed at the interface among various successive stages. Customer order is triggered when a product's level reaches a certain low level as it is consumed through usage and sales. Forecasting and product need verification verify the need to order new stock based on usage and sales in addition to studies of trends, product availability on hand stock, and product cost. Product selection and procurement used to select the appropriate product to order based on availability, cost verification, order quantity, lead time, and delivery date. Receive, store, and distribute used to receive order products based on approved orders, also to verify that the products are delivered in the right quantity at the right price and on time. Budget inventory management and cost containment. This represents the SC fiscal responsibility to the organization as general policies and budget concerns are addressed and orders are optimized to meet overall organizational goals. The process illustrated in the figure is a typical SC process. However, instead of the consumer being the central focus, many organizations are looking at the cost to revenue approach as a central focus. By placing this process focus into perspective, successful SC managers find their competitive advantage by optimizing the balance between the concept of meeting consumers' demands and the fiscal responsibility. In the SCM process, the price elasticity of demand plays an important role. The challenge becomes ordering the best product at the best possible price that satisfies the needs of the majority. This becomes critical when budgetary restrictions are in place. Standardizing products that meet the needs of all involved within optimized inventory levels is a tough decision for SG managers to make. Deciding the location and capabilities of warehousing facilities is another challenge in this area. To balance consumer needs and the organization's profitability goals, the consumer's input becomes valuable at the time the organization needs to decide how that will fit into meeting financial goals. Budgetary limitations lead healthcare SC managers to incorporate new functions and policies into their procurement, inventory management, and distribution cycles. One of the biggest challenges facing healthcare SCM operationally is maintaining sufficient inventory levels to sustain quality and timely patient care. The other is wastage. In the healthcare SC environment, a considerable amount of the inventory is moved on a daily basis. It is then necessary to maintain appropriate stock levels of those items, many of which are quite costly. Operationally, the challenge is in finding and then maintaining inventory balance so that hospital budgetary requirements and consumer demands are met. For the proposed simulation models and its limitations, simulation models facilitate the design and management of healthcare assets through producing a holistic view of all involved elements and providing what-if analysis tools. With respect to SCM issues, SM can support decisions concerned with policies, planning processes, inventory management, and suppliers or consumers collaboration agreements. SCM activities, while the customer service initiatives include the two main elements for consumer satisfaction, which is product availability and response time. Assumptions made by the modelists during model development to simplify the reality of SC are also addressed in the discussion. For optimizing scarce drug allocation, Swaminathan proposed a SM-based decision support system to support the drug distribution project in the state of California, USA. DDP aimed to maintain fair and equitable scarce drugs distribution in the state with the involvement of 150 clinics and 25 pharmaceutical companies involving 125 drugs in 20 drug categories. The allocation problem was described nonlinear, nonlinear, multi-objective, and large in size. Therefore, the proposed DSS utilized a multi-objective optimization model and a heuristic solution to accomplish optimized distribution while taking into account efficiency, effectiveness, and equity of the drug allocation process. Allocation efficiency is a model was measured by the extent to which all drugs are distributed to clinics with the maximum dollar value of drugs allocated in a given ordering period. The model was set to perform accordingly to several constraints, which are clinical constraints, pharmaceutical farm constraints, and allocation constraints. The proposed DSS in the work was proven successful at providing efficient, effective, and fair methods to allocate scarce drugs. The objective was to minimize wastage and holding costs while maximizing prompt access to the drugs. Markov decision process was used to model the drug demands as a function of patient condition and accordingly decide the appropriate level of drug inventory and the drug order quantities. The objective functions were to minimize all associated costs including stockout costs for both finished and raw goods and inventory expiry costs and maximize timely access to the required drugs. State definition in the corresponding MDP involve two components which are patients and inventory is defined as a multi-dimensional vector to meet the assumption of two drugs forms raw and finished. The model also defined a set of transition probabilities to capture changes that may occur in patient classification from one type to another as well as changes in demand. Results indicated that the optimal policy has a base stock structure within which base stock levels are dependent on the raw and finished goods as well as the patient type mix. The optimizing all products inventory, the proposed system is aimed to meet the requirement of healthcare SCM. With the assumptions that the product's demand is normally distributed, the constraints set for this model include the following, which are inventory constraints, space constraint, constraints, criticality constraint. The model was implemented using optimization programming language to generate an optimal inventory policy to achieve a solution that has many products of high importance at high service level. The proposed work focuses on the issue of limited product storage space in hospital sites under the assumption that products are supplied with regular demands. Suggested model optimizes the logistic process by changing the effort described principle and redesigning the process of improve item availability and reduce costs at the same time. The proposed model addresses two problem formulation settings. One is deterministic optimization and the another is non-deterministic optimization. The optimal delivery schedule forecast in all cases is computed using a dynamic programming approach. Proposed strategic solutions were compared against different costs in a simulation environment. The model was set to perform under the following constraints, which were demand satisfaction, flow persistence between ST members, storage capacity, aggregating all items, producer supply capacity affecting all potential buyers, non-negativity and integrality of decision variables. The solution of the model involves selecting traveling paths within the minimum cost to distribute inventory. The proposed model was designed to decide when each CPU will be visited and which products will be delivered in each visit, when each supplier will deliver to the hospital and which products are included in each delivery, and what inventory quantity is shipped directly to CU on the same reception day. The model included two types. The first one is M1, which was an inventory cost oriented model with an objective function to minimize the total cost of inventory and human resources, and the second type was M2, which is aimed to provide activity schedule that balance the workload over the weekdays and introduce this objective into M1. Both models M1 and M2 are set to perform under several constraints, which are set time restrictions on manpower to accomplish the required activities. Direct deliveries are restricted to products received within the current period. Demand satisfaction, respect of storage capacity, and no product is received if the supplier does not visit the hospital. And lastly, products at CU can only be replenished if unit is visited. The increased interest in SM for healthcare SCM is not without its challenges. In the light of models discussed above, the most challenges faced by simulation modeling community in healthcare SCM are as follows. Collecting sufficient amount of related input data, SM validation and verification, implementation and the cost, generalization, growth in model size and complexity, representation of human decision making, match between SM techniques and SCM problems, expert modelers, expert users, integration of existing models. To fully exploit the SM opportunities in healthcare SCM, several and different technologies have been tried to meet the challenges presented above. Some of the following technologies may seem irrelevant to SCM in healthcare, yet the popularity and usability advantages offer a potential shift in paradigms that will incorporate SCM with some of them to leverage some potential problems. The promising technologies are agent-based simulation, radio frequency identification, distributed simulation, service-oriented architecture, and cloud computing. Among aforementioned technologies, RFID and DS are still the only two practically tried technologies to aim to aid SM for SCM in general and in the healthcare context in particular. The rest are still at the conceptual level. This implies that more robust research and development activities are required in these areas to realize the opportunities of these technologies in enhancing SM capabilities of support decision making in healthcare SCM. Over the decades, a variety of organizations, including healthcare, began using computer modeling and simulation to enhance their operations. Simulation modeling emerged as a tool to develop specific functional and decision systems that provided flexibility, specificity, and consistency. Healthcare simulation modeling is a way to test changes in a computerized environment that will hopefully put forward ideas for improvements and subsequent implementation. By offering direct feedback on suggested changes, SM allows healthcare supply chain organizations to analyze different scenarios for decision making while encouraging open communication to further understand the inner workings of a potentially complex system. Implementing SM in healthcare SCM requires the candidate organization to be well structured, integrated, and prepared to implement and use such a system. There are many strategies for modeling healthcare SCM that can be used depending on the problem and the results the organization is trying to achieve. As steps are being developed for the success of simulation, it should be viewed not just in the use of current and future technologies but also its application to the clinical environment. As new technologies emerge to mitigate concerns regarding implementation, potential impact, and value added for healthcare SC processes, it then becomes necessary for healthcare organizations to realize the likelihood of simulation modeling to enhance their operations and maximize the benefits. So that's all from my side. Thank you.